Good afternoon, everyone. I'm Graham Richardson with CTV Ottawa and 580 CFRA. Thanks so much for being here. We're thrilled to be a part of this. I am as well, your host for the first ever Compelling Conversation series presented by the Center of Excellence on PTSD, the Center of Excellence on Post-Traumatic Stress Disorder and related mental health conditions, builds on strong community networks to create the best possible supports and services for veterans, first responders, and importantly, their families. Before we get started, we'd like to acknowledge that the land on which the Center of Excellence at headquarters is located is the traditional unceded territory of the Algonquin people. The Center of Excellence respectfully thanks the Algonquin people for hosting us on their ancestral lands. As a national organization with staff and partners across the country, the Center of Excellence further acknowledges our collective presence on the traditional territories of many Indigenous nations. In recognizing this space, it's our collective responsibility to honor, protect, and sustain this land. Miigwech, and thank you. And today we're here to have a conversation about how to powerfully and positively report on veteran mental health ahead of Remembrance Day, a very important subject for me and for anybody who cares about the history of this country and going forward. The Center of Excellence, in collaboration with the Douglas Hospital Research Center, has launched a new study to assess the tone and content of veteran media coverage on mental health. The findings will be used to create interventions that can help create awareness for young journalists about the issues related to veterans' mental health and suicide, a very important and burgeoning, unfortunately, part of our national discussion. The development of these interventions will be informed by an advisory group for journalists, veterans, and veteran family members. Our panel today reflects a veteran family member, and a journalist to open the important conversation around veterans and the media. Feel free to use the live chat feature for comments and questions that will be answered at the end of the panel during the question and answer. Well, to start things off, I would like to welcome Dr. Patrick Smith, the inaugural president and CEO of Canada's Centre of Excellence for PTSD and related mental health concerns, funded by Veterans Affairs Canada. Previously, Patrick served as national CEO of the Canadian Mental Health Association, as well as the CEO of Renascent, Canada's leading abstinence-based residential addictions treatment provider. Patrick also served as Vice President, Research Networks and Academic Development at BC Mental Health and Addiction Services for the province of BC, and was founding head of UBC's Addiction Psychiatry Program. Before that, Patrick served as Vice President of Clinical Programs at the Center for Addiction and Mental Health and the head of Addiction Psychiatry Division at the U of T. As a clinical psychologist focusing on addictions, he received his PhD from the University of Nebraska and internship and NIDA postdoctoral fellowship at Yale School of Medicine. Great to see you, Patrick. Thanks so much.
Thank you.
We wanted to start by asking about the Center of Excellence and how did it come to be? And I know you also wanted to acknowledge where you're coming to us from today.
That's right. And so, yes, before I get started, thank you so much, Graham, for being here. And I'd like to reference I'm presenting from Stratford, Ontario. And so that in Stratford, it's the traditional territory of the Anishinaabe, the Haudenosaunee, and the Ojibwe and Chippewa peoples. And this territory is covered by the Upper Canada Treaty. And
all right.
I'm quite excited about this panel because this Center of Excellence was one of two core mandates for the Mental Health Advisory Group for the Veterans Minister. And one was to develop a veteran-specific suicide prevention strategy. The other, a Center of Excellence for veterans and their families struggling with PTSD. And similar to other countries like the US, other NATO countries, US, Australia, the Canadian government recognized that those who've served our country, who struggle with PTSD, and their families deserve a Center of Excellence to really move the needle on better supports for all Canadian veterans.
Could you tell us a bit about the goals of the center?
Absolutely. The way I like to say it is whatever we do has to be looked through the lens of fast-tracking positive impact for veterans and their families across Canada. What we know is that we do have to invest in new research and knowledge about how to better understand and to respond to the services and supports that veterans and their families require. But we also know that if we just implemented across the country in an equitable way, access to the kinds of services that veterans and families need that we already know are best practice, it would go a long way in meeting their needs. And I think it's important that all the veterans and family members I've spoken to have really said that there's been a situation where many voices, the faces of veterans, have been lost. I'm wearing teal today. Teal is the official color of post-traumatic stress disorder. It also happens to be the color of military sexual trauma. So when we talk about veterans with PTSD, we often think about combat stress on deployment, but we don't always think about the vast diversity of veterans' experiences. Some, their journey to PTSD may have been through military sexual trauma or the LGBTQ purge. Some have moral injury. So one of the things that's exciting is to be able to make sure that we're building this Center of Excellence with all veterans' voices in mind.
And a part of this discussion as well is about the media and engagement with the media. Why is that important from the center's perspective?
Well, I think it will be able to actually expose and express the vast diversity of veterans' voices that we have across Canada. The women and men who have served our country, who are serving now and have served in the past, there's a rich diversity of experiences. The family members who've served and have supported their loved ones in struggle, the resilience in some of their stories, being able to ensure that all of that rich diversity is represented when someone turns on the news or picks up a newspaper or reads the news online, that all Canadian veterans and their families can see themselves reflected.
Which hasn't always been the case, and that's what we're trying to address here. It's great to hear that from you. Thanks so much.
Thank you. And I want to thank you, Graham, for being here and to facilitate this panel, but also wanted to ask you, as a journalist, what kinds of changes have you seen over the years in terms of being able to report on the diversity of veterans' experiences and their family members?
Well, I think, to be blunt, for many years, this story was not as important to the public, even though it should have been. Mm. So I think through years, a few things happened. Perhaps arguably post-Korea, Canada was not as engaged internationally in conflicts. They were engaged in different conflicts or in conflicts that were not as high profile. Mm. And then the other thing that happened is the situation in Somalia that when I was coming up through reporting ranks, cast a certain light on the Canadian forces that the Canadian forces had been able to get out from under. I think the combination of those two things, in many ways, with the exception of November 11th, pushed veterans issues down the interest level for the Canadian public and for the media as an extension of the Canadian public. All of that changed with Afghanistan. All of that changed with the outreach that Chief of Defense Staff at the time, Hillier, did so effectively. And I think you now have a broader understanding of the sacrifice, of the costs, and of the overall responsibility for Canadians to engage with military post-service. I don't think it's acceptable in any newsroom or in any public square now to question the value of military service and veterans. I don't know that you could say that at certain periods of our time, and that has certainly changed for the positive. So I think if I had a struggle, personally, because of my age, I'm 50 now, so I wasn't wanting to head off into combat zones in my 20s or anything like that. But as I was coming up and starting to report, it was not as front and center, certainly as it was during my 30s when I think the rest of Canada woke up to the military again.
Mm-hmm. And do you think it helps for journalists to hear the stories of veterans, the vast diversity, and family members? And what do you think is going to be the best way for us to really open the gates and help all Canadians really understand the diversity of those who serve our country?
I think that the best way to do that is through personal stories, and any story in particular, because veteran stories are so personal, and they're dealing with things. Many of them are dealing with things that Canadians can relate to. You are not talking about a subject that does not touch the human heart. Stories that touch the heart are always more compelling, whether it's television, radio, or thousands of years ago. Anything that humans can relate humans with, people, that's a connection. And I think the veteran's story is one that millions of Canadians can relate to. Both the fact that they made the choice to enlist and to sign up for this work, and the fact that afterwards there is work to be done to make them whole or to integrate them back into society. That's a change that I think all Canadians can relate to. So if you boil it down to the personal, and to the varied personal, it's not everybody's story is the same. That's where you can get that connection with the Canadian public.
Well, I like hearing that, because, the title of our series is Compelling Conversations. And I think that that's what I know for me has made a difference, is having those compelling conversations with veterans who've served, their family members. And I always leave those conversations with better understanding and better appreciation of the service that they have provided. So thank you so much for this. And I look forward to the rest of the panel.
Thanks so much, Patrick, for speaking about the center and all of the work that is going on there. Very important work. We're going to move to our panel discussion. And our first panelist we want to introduce to you is Robert Thibault. He's a retired regular force captain and proud Métis. He enlisted in the Canadian Armed Forces as a private. He began his military career in January of 1972 with the PPCLI, the Princess Patricias, of course. He served with the 1st and 3rd Battalions, the Canadian Airborne Regiment, and numerous training schools across the forces. He has also served in operations including the 76 Olympics in Montreal, Cyprus in 1978, and Bosnia in 1997. In 2012, Robert became president of Aboriginal Veterans Aducton, a position he continues to hold. When released in 2009, Robert created an Aboriginal company designed to teach Aboriginal awareness training and conduct cultural training for various Indigenous courses within the Canadian Armed Forces. He's established a small network of highly respected elders and teachers, some of whom are veterans. And with these extraordinary people, he delivers a comprehensive training program. Eagle Vision Leadership and Training Incorporated, as it was created, is to ensure the pride of who we are as Aboriginals, allows them to revitalize and regain some of their lost cultural ideas, including their spirituality and ceremonies. They also seek to better educate mainstream Canadians to their uniqueness in both their culture as well as the trials and tribulations they have seen since colonization. Welcome, Robert.
Okay, thank you very much. Ani, bonjour, kwekwe, good afternoon. This afternoon I'm in Kingston, and I acknowledge that I speak to you on unceded Mohawk territory and offer my personal respects to Chief Miracle and the Mohawk people from this area. Canadian journalism, as it reports on military training or operations, has certainly changed over the years. My military service began in the early 70s, which was the Vietnam era. Reporting on various protests, violent or non-violent, from the United States were certainly pro-demonstrator, which was due to the opposition against that war. Reporting in Canada at that period was also negative towards military, as fallout from the opposition to Vietnam could very well have been the case as well. Operations that the Canadian Armed Forces went on throughout the 70s and up towards the 90s was not necessarily reported or one could say underreported. In the 90s, operations came to the forefront with the former Yugoslavia, Somalia, as well as Rwanda. These were not necessarily reported fully, and as such, actions of the Canadian Armed Forces at the Medak Pocket, for example, was kept from the public domain for a long period of time. Somalia, certainly a big turning point for both the military as well as journalism. After the sensationalism of the final inquiry and the results of this, the military began soul searching as to how they could move forward in order to regain the trust of the Canadian public, those brothers and sisters in arms within our ranks, but also how well can we do and how more effective can we be interacting with the media. I am certainly honored to be here participating in this panel discussion, and equally honored to be part of the Center of Excellence team in an advisory capacity. The term post-traumatic stress disorder, PTSD, came to the forefront in the 90s after soldiers were returning from Yugoslavia. This doesn't mean that it was not affecting soldiers prior to this time, far from it. Historically, PTSD has affected countless military, first responders, and some others that have been exposed to horrific trauma. I was deeply disturbed when the reporting of the Crazy Train incident in Winnipeg hit the headlines. Media reporting wasn't the problem. I felt betrayed. I knew that military leadership training for junior and senior leaders had always emphasized looking after our subordinates, looking after our troops. Training did not include the rating or belittling, but did include the professionalism of the leader to provide direction to subordinates, whatever those reasons were. The media, in fact, opened the door on the incidents of harassment of those soldiers suffering from this new found PTSD. It may well be that this reporting of the Crazy Train incident could have been the driving force behind where we find ourselves today, dealing with not only PTSD, but mental health issues. I consider that to be positive influence from the media. As PTSD began to take its toll in the military, followed by the increase in suicides, media reports sometimes looked at sensationalizing these tragic stories for print. Some took these tragic suicide events and tried to connect with victims' families or friends who were still grieving. Canadian Armed Forces members and veterans groups consider these actions to be a breach of trust and a lack of respect to the privacy of victims and their families. I must mention that the Indigenous population in Canada has for countless years suffered the tragedy of suicide, and most sources will quote that it is the highest in the world. When PTSD and suicides in the military were reported in through media and the Canadian Armed Forces and DND, along with VAC, began working on programs to counter problems, I asked myself why. If the rates of suicide in Canada are greater in one demographic, and for many years, why then was there nothing or very little done to address the problems by other internal government departments, such as Indigenous Affairs, Public Health, possibly VAC as well, because we do have a number of veterans? Was it because those suicides occurred in isolated or rural areas? Media exposing the military with its unique, troublesome problems pushed back on CAF and VAC to take action, which they did and continue to do. However, why has the PTSD and suicides of our Indigenous groups not been addressed? And there has been very little improvement over the many years. Mental health and its effects are not race nor gender based. If media had continually pushed those suicide stories, of Indigenous communities on the severity of cases of mental health and suicides, could that have pushed those other departments, those other government departments across the country, would that have forced them into action? I'm sad to say, but thankful that we are now on a national level looking to change the momentum and tackle both PTSD and suicide. I expect that all research will include those in rural and isolated regions of Canada. When I think about media reporting, I want to stress that respect, honesty, and compassion are taken into consideration. Consider the negative impacts on vulnerable individuals while ensuring the accuracy of the story. So, in years gone by since 1972, I must say I did have a reluctance and a resistance towards speaking with any media. As a Métis person, I always considered myself as being a soldier working with soldiers. In the early 70s and up to the 90s, as I said before, media reports didn't appear to be much fact-based or complete, probably more incomplete than facts than saying not factually based. This may have been due to in part, that Vietnam War that was going on, the US military, how it negatively depicted or was negatively depicted during this conflict. That lack of trust and disdain for conflict extended to all global military forces, including Canada. I was wary and cautious to deal with the media, and therefore I kept my distance. As the Rwanda operation was gearing up in Petawawa, it brings to mind an interview that was done with a female sergeant who was a medical assistant and deploying with the Canadian Field Hospital. She had resisted the request to be interviewed by the media at least 3 or 4 times, but after some pushing, she eventually relented. She would do the interview as long as no questions were asked about the Canadian Airborne Regiment or Somalia. It was around this time that the Somalia inquiry was beginning. The journalist agreed. However, near the end of the interview, which was being done live on radio, she was asked if she had any concerns with the airborne platoon deploying with them so shortly after the Somalia mission. Looking for an answer, he was disappointed at the response. I am extremely happy to be deployed on the mission, and with the security being provided by the Canadian airborne soldiers, I feel totally safe with them. When reporting or setting up for interviews, there is nothing wrong asking hard questions. However, respect, accuracy, and a bit of compassion should be a consideration. Overall, I believe that media reporting in this country is for the most part accurate, and I trust that through the next important steps in PTSD, suicide, strategic research, and planning, that this reporting will remain consistent. My advice for media on this tough subject is to take the story and report progress, and ask the Government of Canada the hard questions regarding any strategy. The emphasis is on the well-being of those who suffer. Journalists and media in general certainly have challenges of its own, and their biggest challenge is social media and how we stop misinformation from this source and provide the most accurate information available. Social media is proving to be a double-edged sword, and caution must be taken to ensure that factual information replaces the so-called fake news. Miigwech, Marcy, Merci, Kajanamek, all our relations. Thank you very much.
Thanks so much, Robert, for sharing your story on behalf of everyone in the community. Thanks for speaking with us today. We want to continue. Our next panelist is Catherine Linford. Catherine's been married to Chris, a Canadian Armed Forces veteran, for 34 years. She's the mother of 3 children, 2 of whom also serve in the military, and 2 beautiful grandchildren. Catherine has served as a board member for the CFB Board and Military Family Resource Center, one of those important resource centers, so many of them around the country, helping to organize events to support military families. She's lived with and helped manage her husband's PTSD since 1994, when her husband returned from obviously a very challenging mission in Rwanda. Catherine's the co-founder of the Wounded Warriors Canada COPE, Couples Overcoming PTSD Every Day program, as well as the Wounded Warriors Canada SRP, Spousal Resilience program. As one of their health services coordinators, she currently administers these programs and has participated in many of them as a support person. We'd like to welcome Catherine this afternoon.
Okay. Thanks for having me here today. I'd like to start with a bit of my story as a military spouse. I've been dealing with PTSD, or post-traumatic stress disorder, in my home since 1994, when my husband Chris returned from Rwanda. Sadly, he was not diagnosed for another 10 years after his return. I supported him and continued to raise our children, not knowing what was going on with him or us, not unlike so many other spouses. I took on the majority of chores around the house, like taking kids to school, homework, lessons, extracurricular activities, so on. At the time, I thought I was the only one struggling with this, but now I know that was not the truth. I never wanted to wallow in the negative, plus I didn't want anyone to know how much we were struggling. I was in survival mode, so I kept on going. I was the protector of my children. I tried to guard them from what PTSD brought into the home, as well as I tried to support this new version of my husband. As a result, I lived a guarded life and put walls up to protect everyone. I managed to hold it all together until the kids left home to follow their own dreams, and Chris finally started to feel better after years of therapy. This was when I finally had a chance to look at myself and realized how much I needed help. Chris's health continued to improve and had a positive light, but I was exhausted and felt very much alone. We were posted to a new province, leaving behind our daughter, who had just graduated from high school and wanted to pursue her own dreams. She had been my only support system, and with that move, I had no one. I felt so alone. I wasn't even sure if our marriage was going to survive. Neither of us were sure we wanted to stay in it. I now know I was completely burnt out and tired of all those years of being supported and trying to protect each member of our family. On top of that, Chris was getting the mental health support he needed from the military, but I was not. I felt abandoned and forgotten. Who was going to help me? That's where the COPE program came to light. COPE is an acronym, and it stands for Couples Overcoming PTSD Every Day. I was searching for support to help me. I tried some therapy and support groups, but they were not the right fit for me. Something was still missing. During this time, Chris was doing a program with Dr. Tim Black, and when I finally met Dr. Black, I asked him if why there wasn't a program for spouses. I was very frustrated and disillusioned. There seemed to be so much care for veterans and so little for the spouse and family. All I wanted was for my voice to be validated and to feel needed again. With Dr. Black's clinical expertise and assistance, the three of us created the COPE program to get couples on the same page regarding the management of PTSD in the home. With the generous funding of Wounded Warriors Canada, we knew that the couples struggling with post-traumatic stress find it difficult to communicate with each other. We had lived with this and were turning a corner back towards health as a couple. I felt heard for the first time and enjoyed meeting the other couples who attended the COPE. I found strength with my voice again. Knowing I had a husband at my side cheering me on gave me more strength and energy to heal myself. Fast forward a few years, and with the help of Dr. Black, Claudine Barret, Carolyn Turner, we created the SRP, or the Spouses Resiliency Program, which launched this past January. And for me, that was the icing on the cake. It addressed all the things I was hoping for, including solid information on trauma, its effects, tools to help me cope, and a wonderful support system. From my years as a military spouse and doing these programs, I have seen that the spouse is often the silent partner, keeping everything together at home. But I have rarely seen the media cover this side of the story. Why was I never asked how I was doing? We, the spouses, keep going and try to carry on like everything's normal until the day that it isn't, and we can no longer carry on. My message to journalism is, be curious about the role the spouse in the family are struggling with PTSD. See how strong and resilient they are, the spouses and the kids. There's a lot more to the story than meets the eye. I am very proud of my husband's military career, as well as my 2 sons who also served in the Canadian military. Our daughter Jennifer served as the child of a soldier who suffered greatly due to having a dad with PTSD. I want to make sure her voice is heard and validated as well. Remembrance Day is soon upon us. The veteran deserves all the attention that day represents, but for all those days that follow November 11th, I wish a little attention could be afforded to the sacrifices of the family. They too were impacted by the results of a military service.
Thanks so much for that perspective, Catherine. A very important piece of the story, veterans and their families across the country. We now want to hear from Dr. Robert Whitley, a principal investigator of Veterans Media Analysis Study. Rob is an associate professor at the Department of Psychiatry at McGill and a research scientist at the Douglas Research Centre. The Douglas Research Centre is Canada's second largest centre devoted to mental health, and it's embedded in a large mental hospital. The research center affiliated with McGill University. We wanted to welcome Dr. Robert Whitley.
Thank you, Graham. And I would like to start by saying I'm very honored to be here in such esteemed company. And I'm very pleased to hear the testimonies from my colleagues, Robert and Catherine, and Patrick and others, because everything we're saying will converge this afternoon. And even though we come from very different backgrounds and we're approaching this issue from very different experiences, we're all pointing in the same direction. And I think that's very important for a project like this. For myself, I'm a researcher. I've been researching media coverage of mental illness for over 10 years. We do know there is a large corpus of international research from a variety of countries that indicates that media coverage of mental illness does include a lot of stereotypes and a lot of stigmas. This media coverage can shape wider public attitudes towards mental illness. For example, if media coverage focuses on negative factors, if it focuses on things like crime, if it focuses on things like violence, when we talk about people with mental illness, then that will shape a culture of fear, a culture of suspicion, and a culture of rejection. Over the last 10 years, I've worked closely with the Canadian media in an effort to try and catalyze change in the reporting of mental illness in general. This 10 years has gone very quickly. I've worked with all different sections of the Canadian media, all different political hues, all different provinces, print media, TV media, other media, and we are fortunate in the last research study we conducted to see that there has been an improvement in media coverage of mental illness over the last 15 years. This is a significant improvement, and statistically, this is indubitable. So this is good news. This is the inspiration for the current project. There has been research in the United States which shows that the depiction of military veterans in that country tends to focus on negative factors. Some research studies show that a typical portrayal of a veteran is someone who is angry, someone who is withdrawn, someone who is bitter. We see metaphors used which are very inappropriate, for example, calling military veterans ticking time bombs, or people who are prone to be triggered or prone to snap at any moment. These are very offensive. Here in Canada, we do not actually know how the media is portraying mental illness. There has not been a systematic research study on this topic to this date. Given this situation, I'm very pleased to receive funding from the PTSD Centre of Excellence to conduct a 2-year research study where we aim to analyse systematically the tone and content of the Canadian media in how it reports veterans' mental health, and how it reports veterans' suicide. In this 2-year study, we will retrieve, collect, code, and analyze media reports about veterans from a variety of different Canadian media. We will do this on a day-to-day basis, and it will give us a chance to analyze general patterns and the lay of the land, and will also give us a chance to analyze time trends and if there is any longitudinal change in media coverage. In year 1, our primary aim is to collect and analyze data. We will look at how the media is covering veterans issues, veterans suicide, veterans mental health. We will also conduct a series of sub-studies. So for example, we are currently conducting a sub-study where we are analyzing the media coverage of the suicide of Lionel Desmond to see what the tone and content of that media coverage was. It's very important for me to say that we are conducting this research from a position of neutrality and equipoise. We are not prejudging the media. We are not assuming that the media in Canada will be similar to the media in the US, where the research has shown that portrayals do tend to be stigmatizing. As I said in my introduction, I've worked with the media for 10 years. I understand that journalists are under a lot of pressure to be experts in many different areas, and that it's difficult to report on certain issues, including suicide and PTSD, and it's a learning curve for everybody. Veterans fought to preserve our freedoms, and I myself in this research study and the wider team believe in the freedom of the press, in freedom of speech, in the freedom to report in a manner which journalists think is appropriate to themselves. That being said, we do believe that it is important that media coverage is fair, that media coverage is balanced, and that media coverage is accurate. And to use a word Robert repeated many times in his piece, respect. To that end, in the second year of this study, we will develop educational resources which we will disseminate to our media partners all over the country, from different political hues, the print media, the television media, the radio media. It is our aim, hopefully, to develop guidelines, hopefully to develop online resources, hopefully to develop a website. And like I said, the aim is not censorship, the aim is not to muzzle journalists, the aim is not to name and shame or criticize. The aim is to provide educational resources that can help journalists in their efforts to report a more fair, a more balanced, and a more accurate way when they're talking about veterans, when they're talking about veterans' mental health, and when they're talking about suicide. We are approaching Remembrance Day. This is one of the few days of the year, perhaps along with VE Day, where veterans and veterans issues come to the fore. It is my sincere hope that we will mark this day in a manner which is befitting to the service that the veterans have given us in this country. It is also my hope that as we go into the future, we will mark veterans and pay them the respect and honour that they deserve for the rest of the year. I'd like to thank again the organisers of this panel and thank the audience for coming to listen to us this afternoon, and I'm looking forward to any questions. If you do not have a chance to ask any questions in the chat box, feel free to email me at robert.whitley@mcgill.ca. Pour fin, je veux dire quelques mots en français. Aujourd'hui, c'était important pour faire un petit résumé de mon étude dans 5 minutes. Puis j'ai parlé en anglais, mais si vous avez des questions en français, vous pouvez m'envoyer un courriel à robert.whitley@mcgill.ca. Merci.
Thanks so much, Dr. Whitley. Always great to hear directly from a researcher on these very important issues. And we wanted to bring back Patrick before we head into the question and answer. Patrick.
Thank you so much, Graham. And I really want to thank you for hosting this first of our series, Compelling Conversations, and also for sharing your own personal experiences over the years and your observations as a journalist in covering the stories of Canadian veterans and their family members. I also want to thank all the panel members and invite them to join me for the panel discussion. I'm quite looking forward to that. And we've got many questions that have been sent in advance and also when you registered and also in the chat today. I also want to emphasize that this is being recorded completely. And once we have everything recorded, this will go to full translation, and this will be available for everyone, and it will have French subtitles. So once we have everything in the can, it's going to translation, and we will be distributing this this full recording in both languages. I do also want to say we do have Francophones on our team standing by to read out and translate any questions that anyone may have in French today. You know, what's exciting for me about this research initiative, Dr. Whitley, is that it's not just that we're going to have the results in November of 2021 and it's moving on to the next project. Everything we're going to be doing in the center is about, yes, adding to the knowledge, the research, but what are we going to do with that? It's going to be about mobilizing that across the country to journalists and all partners who need this information. If it doesn't have an impact on Canadian veterans and their families, then why do it? And so that's really an important thing for us. I also want to recognize for those out there, we're talking about PTSD, we're talking about suicide. And so if there are any, we want to really promote self-care, and we want to let you know that help is available. And I think they're going to put on screen now for the supporters, the Canadian Suicide Prevention Service line. And of course, if anyone is having any challenges, any emergency, please call 911 or go to your nearest emergency. So Bob, Catherine, and Dr. Whitley, thank you for joining us. And I think I'll ask the question that has been kind of tearing up the news waves here. Intersectionality, and Bob, you talked about it. You talked about Métis and Indigenous veterans who are not only soldiers, but maybe they're coming from a context of intergenerational trauma. Maybe they're in remote communities where they don't have access to the same services that other Canadians have access to. And Dr. Whitley, others have talked about the issues of intersectionality that we haven't always looked at. We've looked at people in a kind of more uniform way, and not understanding that someone may be a veteran, but they may also be Indigenous, or they may also be LGBTQ. They have so much richness in what they're really representing. So Bob Thibault, I wonder if you can talk a little bit about that from your perspective, and how important it is to have the fullness of someone's experience be represented in any media or media coverage or anything else.
Thanks, Patrick. I've been speaking probably since we started our veterans organization. I've been speaking about the lack of communication, lack of resources, lack of services to the rural areas, and then also to the north, Yukon, Northwest Territories, and Nunavut. And it's kind of, it's like if you're sitting here and you pick up your iPhone and you do something, your expectations are this, that whenever I hit that button, because we're all doing it, I can get a response right away. Mm. Where people don't understand that not necessarily that happens in these isolated areas, because if they do have a computer, they may not have high-speed internet. And I'm really happy that my good friend Floyd Powder is going to be on this committee with the other PTSD, because he represents all of those people in the north, because he's been to every community in the north, the Ranger program, and he was part of that for a number of years. So I'm excited about that. But the problem is we've got to keep our finger. Once you get in there, you got to keep doing it.
Yeah.
And how you do that, this virtual stuff is fine down here. It's great. But I've also said that VAC and the other people have to get into this, get into these isolated and rural areas and get the stories out, because there's certainly a lot of the First Nations, Inuit especially, and some of the Métis will return back to those communities that they came from. The Métis, mostly northern Quebec, or pardon me, northern Saskatchewan, and Northwest Territories and things like that. So it's important getting into those places to get all of those services, because it's a shame when when I brought up the suicide thing, it's from the heart, because it's heartbreaking when you know that there are youth out there, young kids, that are committing suicide, and they're doing it sometimes in packs. So,
and you mentioned that, and you also mentioned, the role the media could play in terms of keeping the eye on the ball. And I wonder, Dr. Whitley, what are your thoughts about how a more balanced and accurate, and I love what you've both said, and Bob, respect, honesty and accuracy, and compassion. And so, Dr. Whitley, what do you think are some of the ways that we're going to be able to make a change in the way veterans in large and journalists in large cities, and also in small town newspapers or the local news in rural and remote communities, how is it that we're going to have that impact, thinking about the various perspectives that different people across Canada will have, and their different context?
Thank you, Patrick, and hello again, everybody. I guess one thing I'd just like to say about myself is that I'm a veteran myself. I'd like to put that out there. I'm also a family member. My father was in the Merchant Navy. My grandfather was in the Canadian Army Medical Corps, and served on the Western Front under Sir Arthur Currie in the First World War. So I'm here mainly as a researcher, but I also have personal skin in the game, which is why I'm very honored to be part of this great team and to work on this project. I think in answer to your question there, Patrick, we need to look at research that has happened with populations who are not veterans and then extrapolate to the veteran population, because the actual research hasn't really happened. So I did a research study a few years ago where we looked at suicides in Canada in the months following the death of Robin Williams. And our hypothesis was that there would be an increase in suicides in Canada amongst middle-aged men. This is the theory of suicide contagion, that people identify with someone, with other people. They particularly identify people who are like themselves, who share similar demographics. And that when Robin Williams killed himself, that some people who were already vulnerable and who may have been living lonely, isolated lives and had pre-existing problems, had other problems, that they could have identified with Robin Williams, and therefore that could have pushed them further along the line towards a suicidal outcome. It's very important to say that suicide is not monocausal. Suicide is multifactorial. It's caused by a variety of biological, psychological, social factors, all intersecting and interacting, as you implied. So we shouldn't look at it simplistically that its media coverage is the main factor, but it's one of many, and it's an important factor. We do know that veterans very strongly identify with one another, that when you've been in the military, we know these phrases, a band of brothers, comrades, camaraderie, etc., that you carry that throughout your life. And therefore, when there is a suicide of a veteran, it hits all veterans hard. And if veterans are already having trouble and problems, and if they identify with the deceased, then certainly that can worsen their mental health. So for me, working on this study, one of the important things is to work with the media to ensure that if there is a veteran suicide, if they're reporting on the anniversary of a veteran suicide or the inquest of a veteran suicide, as we see periodically with Lionel Desmond, that this is not done in a sensational manner, that it's done in an empathic manner, it's done in an accurate manner, that it doesn't use inaccurate language like commit suicide or successful suicide. It doesn't go into details about the method used, because we know that when news articles go into details about the method used, there's an increase in that method afterwards. So it's really about working with journalists to try and advise them what they can do that will help prevent suicide and will help mitigate any impact. Like I said, it's not about censorship. And I think it's really important to say that we want to work with the media. We want to develop guidelines in tandem with them. We want to ensure that they can talk about suicide and mental health in a way that educates and informs and is not sensationalist. One final thing I'll say, I know time is pressing, is that no public health problem has ever been solved by silence. So there is a myth out there, which is not kind of supported by the evidence, that if you stop talking about suicide, suicide will decrease. That's not the case. There's been studies where they've looked at news markets where the journalists have gone on strike and there's been no news back before the internet, and that didn't lead to any decrease in suicide. So there have been studies on this. You solve a public health problem by talking about it openly, accurately, with compassion, with empathy, as Robert said there, with respect, by involving lots of voices, a multiple variety of voices. So we want veterans family members, researchers, putting their tuppence in and talking to journalists, getting their voices out there. We need stories of hope, we need stories of recovery, we need stories of reintegration. It is a bit of a sad state of affairs, I think, that over 40,000 personnel from the Canadian Armed Forces, from the Canadian Army, the Royal Canadian Navy and the Royal Canadian Air Force combined served in Afghanistan. The story that received, the individual that received the most media coverage is probably Lionel Desmond. And we never hear about the 39,999 others who have made a successful transition, integration, who are contributing to their community and who are living their lives.
Yeah, and so I think it sounds like if we're really able to have an impact on the way journalists do cover with accuracy and fullness of the experience, and if they're better able to do it in a respectful, accurate way with veterans and with Indigenous community, and really keep that focus, that if I'm a journalist, I'm going to get better at covering it in a better way across the board. And and you've both talked about the role of families, and of course, Catherine, you have. The family members, if let alone you don't hear about the other 39,999, but you don't often hear about those family members. And to your point, the stories of resilience, the stories of recovery, the stories of the actual service. I wonder, Catherine, if you were to give, to have your dream for journalists, what are some of the key messages you'd like to send to all journalists and therefore all Canadians about that the unsung heroes of family members supporting military and veterans?
Yeah, you know what? The biggest ask, I think that was my biggest issue through my years. Everybody was focused on Chris's and his mental health and recovery. I was never asked, how are you doing, Catherine? So I think that's what I would like is just to spend a little time and focus in on how the family is doing, how are they recovering, what are they doing to recover? Because often, or it's my experience is that if there is a PTSD in the family, there's secondary PTSD as well. The spouse and or children also have issues. So what are they receiving for care? I think that's all I'm asking for is look beyond as well.
The richness of experiences, the richness of stories, and hearing yourself, your voice and seeing your face represented, it sounds like. And Bob, I really resonated with what you're talking about, where all of a sudden there's this hyper focus on one grouping that has high suicides or something, and then what's it feel like for a community that has had high rates of suicide that have gone, you whip through the newspaper and you don't see those stories. So what do you think what do you think the power is of bringing those stories and the stories of resilience and recovery to life? What are your ideas about how that would make a difference? Oops, you're muted. How important is it that Indigenous communities do see themselves reflected in the stories that they?
One of the hard things for me to accept in the suicide issue with Indigenous people, suicide is not a normal way of life in the Indigenous population. In fact, when we talk about post-traumatic stress disorder, the first time it was ever diagnosed was probably years and years and years, hundreds of years before anybody landed on the shores of North America, and it was a Lakota tribe or Lakota or another tribe that when they went out and did, for a battle that they had, when they came back, the young people were different. They couldn't figure out what was wrong. And the elders at that time said that they were disconnected. There's no connection to them. So they came out with the sweat lodge ceremony as one item to work with. And the aim of that was to ground that. I won't get into the specifics of it, but it does. I've seen it work for veterans, non-Indigenous or Indigenous. But the point I'm trying to make is everything in the community that goes on with it. If a soldier returns to a community and suffering from PTSD, it's now a community responsibility. It's not an individual, it's not a family responsibility. The family is the community. And that is one of the things that I'm hoping out of all of this, that because I do know of a reserve in Quebec that actually had that particular thing happen, and the community came together with ceremony and accolades for what this individual had been through and done. And so that's what
I was reflecting on that, Catherine, when you were telling your story, and even in your answer, that it affects the family, and then more broadly, it affects the community. I know from the Thunderbird Partnership's First Nations Wellness Framework and the whole focus on culture and the whole focus on community, that nothing is happening to just an individual. I'd like to say that on the cusp of Remembrance Day and the other 364 days of the year, hopefully that's something that more respectful, honest, accurate, and compassionate coverage of the rich experiences of Canadian veterans and their families. Hopefully the community of Canada can be more aware and more supportive and really just more respectful and appreciative of the services of all Canadian veterans and their families. I'm getting all my little 2 minutes to my notifications, but would anyone, if just going very quickly, what one message would you like to give to Canadians that would make a difference in how the rich diversity of veterans' experiences and their families, with intersectionality, that a veteran isn't a veteran, they bring to them many different rich cultural contexts and otherwise, what one message would you give to the Canadian people? So I'm going to start with you, Catherine.
Thanks. One message. I think it goes back to me saying, look beyond the suicide. There's more to the suicide than that death. As sad as it is, there's the family that's involved. There's the community involved. There's so much more involved. So that's just look beyond.
Okay. And Bob, what would you say? One message, in addition to all that you said, what one message would you want to give to all Canadians?
I would say it's important for veterans to open up, but you're not going to get every veteran to open up on the trauma or whatever actions they have seen. What is important, if somebody is trying to talk to you, you have to listen. You can't interrupt. You cannot provide advice or an opinion. You have to listen because it's their story. And if you influence that story, it now becomes nothing. So listen and understand. I watched a TED.com video of a veteran from Iraq who had lost 7 friends. He ended up in jail because he beat the crap out of somebody with a pistol. But that was his story was what people needed to hear. And if I could pass a message on to any Canadian, listen to the stories, and it's an eye opener to listen to some people talk. So, and it's worth it.
And Dr. Whitley, what is your message, and what is your hope for this this initiative that you're leading?
I think it's important to say that there have been numerous public surveys about Canadian civilians' attitude towards the Canadian Armed Forces and towards Canadian veterans. And these generally show positive results, so that Canadian veterans and the Canadian Armed Forces are held generally in high regard by the Canadian population. So it's important that we start from that foundation. I think what's happened over time is that more and more people have less lived experience of military life, either directly as themselves or as a family member. So I believe in the United States, approximately 1 in 10 people have either served in the United States military or a member of their immediate family has served in the United States military. Whereas in Canada, I think it's now 1 in 100. The greatest generation who fought in World War II and fought for liberty and freedom in all those countries in Europe, sadly dying away. We have a new generation of veterans who served in Afghanistan, like I said, over 40,000. I would like to see veterans conceptualized as a very valuable resource that we have in our society, that they are people who have discipline, they have resilience, they have a very strong work ethic, they have already served their country once, and many of them are currently or very willing to serve their country a second time in civilian life. And I feel we really need to continue to take a very positive attitude towards veterans. I think it does become more difficult as fewer people have kind of lived experience of the military. Fewer people know people in their immediate family, even their extended family, even their friends. So I think it's also a bi-directional activity that we need, that the Department of National Defence has to work with schools, has to work with universities, has to work with employees, Veterans Affairs Canada. And what I would like to see is more veterans going into high schools, going into universities, talking about their strategies of resilience, talking about their experiences, talking about their reintegration into society, and talking about their service. And really to ensure that the next generation of Canadians coming up, who are probably the most distanced from military life and the life of veterans, are aware of the sacrifices and the service, but also of the contribution that veterans have made to not only peace in Canada, but peace in the world, and stopping tribal civil wars in places like Yugoslavia, and acting as peacekeepers and working to protect the values that we all hold dear in this country. So yes, I'd just like to see veterans considered as a valuable resource and used as community educators and given the chance and the opportunity to serve their country a second time.
Well, I would like to thank all of you, and as Graham Richardson said, it's really about sharing deeply personal stories. And it sounds like, Catherine, there are many that are willing and ready to be asked, and as Bob says, and to be listened to. So we're ending our time here, but I just wanted to say thank you, the three of you, for sharing your personal stories, your experiences. Hopefully this isn't, for us, it's not a one and done. These compelling conversations, it's really important for us to provide the platform for veterans and their family members with a rich diversity of experience that they can share their stories so that other veterans out there can see themselves reflected. And also that, to your point, Dr. Whitley, that more Canadians understand the things that we may take for granted in our day-to-day life and what we owe to the Canadian women and men who've served our country, including their families and including their communities. Thank you very much. And Miigwech, and I look forward to the next compelling conversation. Thank you.
Thank you.
Thank you, everybody. Merci tout le monde.